Hey there, guys. Dr. Corey here coming at you from Choffner Rehab and Recovery. And we bring rehab and recovery to you. All you guys need is a phone signal. If you guys want help or have questions about that, feel free to kind of put a comment down below if you're watching on YouTube or Facebook. I'm grateful to have you guys tonight. We're going to be talking about the most commonly injured ligament in the body. Can anyone guess what it is? Put it in the comment down below if you're watching this live. And if you truly know, right, we're going to give you a little bit of a gift if you get the correct answer in there. And it's got to be towards the beginning of the video, rather than just watching it and kind of putting the answer in at the end. So this month's videos have focused on ligaments in detail, okay? We focused on defining what a ligament is, right? The most commonly injured ligament in the body, which will be today's video. And then the videos to come in the next couple of weeks will be different grades of sprains and how to properly treat them, okay? So guys, do you have any idea what the most commonly damaged injury is, or the most commonly kind of injured ligament is in the body? Probably not, right? I mean, a lot of people get confused about this. Some people think it might be at the elbow. Some people might think it might be at the knee. Some say it might be at the spine or the neck. And guys, it really comes down to, how it happens and why it happens. So we're going to talk about all three of those things. Number one being the most commonly injured ligament in the body. Number two being how does it occur? And number three being why does it occur? Okay, so let's jump into number one here, right? The most commonly damaged or injured ligament in the body is going to be your ACL, okay? And the ACL stands for the anterior cruciate ligament, right? And all that means is that it's the ligament in kind of the front area of the knee that kind of connects different kind of bones there together, right? So it helps stabilize the knee by connecting the thigh bone, which is the femur, to the tibia bone or the shin bone. Okay, so it helps stabilize it so it doesn't shift too aggressively forward, and it helps stabilize it from kind of keeping those bones kind of locked in place. So if you have a sprain or sometimes even like a full tear, like a grade 3 sprain, or complete rupture of your ACL, it's going to mean those bones are going to move excessively, and you're going to have pain usually localized to that one area. It's not going to really radiate too much unless there's a lot of inflammation in the area, and there will be a little bit of swelling as well. But a lot of times it just means that there's a lot of instability there. And that's going to differentiate a ligament issue from a tendon issue or a muscle body issue. Okay, so stability is the number one thing you need with that. All right, how does it occur? ACL injuries often occur during sports or activities, right, that are going to involve sudden stops, right, changes in direction, or even if you impact your knee, such as in soccer, right, basketball, even volleyball or skiing. Right, and these injuries can kind of range from those mild sprains, which are grade 1s, to grade 2 and 3s, and grade 3 can be a complete tear that requires immediate medical attention and sometimes immediate rehabilitation or even surgery. Okay, so that's typically how it occurs. Why does it occur? It can occur because it happens when there's excessive stress or trauma applied directly to the knee joint. Okay, and there are different reasons for this. There are 7 in total. We're going to go through those 7 right now. Number one is there's sudden stops or changes in direction, right? So if you're stopping, you're pivoting on one leg, or you're changing directions quickly, say you're like cutting in soccer, right? The ligament can be strained or torn when it undergoes those rapid movements, especially when the foot is planted firmly on the ground, right? Usually it happens when the foot is planted firmly on the ground, that knee twists kind of too excessively, and it puts too much stress on the knee in too short a period of time, and it can't tolerate it. So that's number one. Number two is impact or collision. High impact sports like football, rugby, or even martial arts, MMA, UFC. I know a lot of people watch UFC in this channel. Those tend to kind of cause that issue from a direct blow or a collision that forces the knee into an unnatural or unwanted position. All right. Number three is landing incorrectly. This is one that I probably see the most, especially in female athletes, especially soccer players or volleyball players, even basketball players. Those are the most common sports, I would say, out of the three. Right, athletes kind of land from a jump with their knees sometimes hyperextended, meaning they're too straight, or they're rotated inwards, right? Their knees could be rotated inwards too much, and that can also kind of damage that ACL over time. It doesn't usually happen just from the first time doing it. It happens from doing it over and over repeatedly. All right, number four is overuse or fatigue, right? Repetitive stress on the knee joint, sometimes like running, if you do marathon runs or long distance running, can weaken that ACL over time and make it more and more susceptible to injury. Number five is going to be non-contact injuries. So sometimes ACL injuries can occur without direct contact or even trauma to the actual knee, right? Sometimes there's a tear during a sudden or awkward movement, like twisting the knee when you're landing from a jump, right? Sometimes when we're walking down the stairs, if you're overweight or you're kind of a bigger guy, bigger girl, and you land awkwardly with that knee in a weird position, you can sometimes tear your ACL that way too, and that's a non-contact injury. All right, then the last two is going to be muscle imbalances. So sometimes weakness or imbalance in the muscles between usually the quads and the hamstrings from the front of the thigh to the back of the thigh, that can increase your risk of ACL injuries. So you want to sometimes have good strength both in your quads and your hamstrings, even your calf muscles, right? Because those all three muscle groups surround the knee joint. Even the anterior tibialis, which is the muscles of the shin bone in the front of the ankle, it's going to help prevent shin splints from occurring or reoccurring. Having good strength and stability of those muscles is really going to help reduce your risk of developing an ACL tear or any damage to your knee in that matter. Okay. And then number seven, right? You always have to throw this one as genetic factors. So some people are predisposed to ACL injuries based on their certain kind of anatomy or their structural integrity of the joints, right? Some people are just born a certain way. They could be born knock-kneed or kind of bow-legged, right? It depends. And, sometimes if your pelvis is in that shape or your knees are shaped a certain way, you're more prone to developing things like arthritis, wearing down of your knees. Your form might be off with certain things. You might have to squat a certain way compared to others. Really important, guys. And really, I just want to kind of, reconfirm that injuries can range from minor sprains, which is grade 1, to complete tears, or also called a rupture, which is grade 3. Okay, and that's going to dictate how long it takes to heal, and how long your rehab process is actually going to kind of be. All right. So now, guys, you should understand the most commonly injured ligament in the body, which is the ACL, and then how and why it truly occurs. Right. Those healing times can range from 1 week to about 12 months, depending on if it's a minor sprain or a complete tear, otherwise known as a rupture, like we just mentioned. Okay. So thank you guys so much for watching. Very quick video for tonight. Be sure to like and subscribe to our YouTube channel. Remember, at Choffner Rehab and Recovery, we reassess and pick up where your rehab and recovery stopped and traditional PT kind of left off with you, and we help weightlifters return to 100%. All you need is a phone signal and a backpack of equipment to get it done. All right, thanks guys so much for tuning in, and we will see you next week. We'll cover how long these ligament injuries should take to heal, depending on kind of how much damage there is and what kind of grade of injury you're dealing with in terms of sprain. All right, thanks guys. Have a great one.